Okay. Our League of Women Voters discussion today is preparing for Utah's abortion ban trigger law. Catherine Weller, past president of the League of Women Voters of Utah, will explain the Utah abortion ban trigger law. And Karrie Galloway, president and CEO of Planned Parenthood in Utah, will let us know where we stand right now, what is likely to happen, how we're being prepared for that, how they're preparing for it. So, and then the last 5 minutes will be Chris Cherniak will let us know where we stand on COVID and monkeypox in Summit County and Wasatch County. So Catherine was going to be a minute late. So I'm going to switch order here. Karrie, would you start us off with the kind of the current situation with Planned Parenthood, and then when Catherine comes in, she can update us on how the bill would work, and then you can continue with everything else. Okay. All right, Karrie, it's yours.
Thanks, Jill. And thank you all for making time to discuss this incredibly, I think, critical topic. As I look at the group as we sit here, we are citizens of a certain age. So we have known what it's been like for many of us not to have a legal right to decide how to handle our own reproduction with our own body, with our loved ones' bodies. Some of us have even been around before we were able to make our own decisions about birth control. And we've had 50 years in this country of a legal right to make a decision within a certain framework set out by the Supreme Court on carrying a pregnancy to term. And we have been in a state of flux, I have to say, since the beginning of time, over the rules, regulations, and morals of people who can get pregnant and what they can decide to do about that. I remember when I first joined Planned Parenthood in 1981, I went through training on contraception. And the Bible, as they say, of that time was a book written from the Emory University Medical School on contraception. And they talked about the history, and they talked about people going across the desert with camels and putting pebbles in camels' uteruses to keep them from getting pregnant on the trek across the desert. And I found that to be a fascinating discussion of the history of contraception when you think of IUDs. Or, of course, there are the historic stories about what have been used for condoms over time, or barrier methods like diaphragms. And we know we've had a long history of men and women trying to control their own fertility, sometimes successfully, sometimes not. And it was in the early 70s when the Supreme Court made a decision in the historic Roe versus Wade that we had a legal right as the pregnant person to decide for the first and second trimester. And then in the third trimester, the state couldn't get involved and make some laws surrounding that pregnancy. And so it's been a long time that I've been part of what my kids used to call the pregnancy wars. And we now are at a time when the Supreme Court has said that we were willing to take up a case to question whether there was an ultimate right for the pregnant person to make a decision about carrying that pregnancy to term. And what is interesting is when the case was first taken up by the Supreme Court, it was only a 15-week case, which said that the state could make a rule that, as opposed to the third trimester, they could have a state interest at 15 weeks. But by the time the Supreme Court took up that case, we had a different Supreme Court than when they took the case to them. And they changed their mind. They said they didn't just want the state to be able to make a decision at 15 weeks. They wanted Roe versus Wade overturned. And it changed the whole rules of what we thought we were talking about. And then the rules were changed again when there was the leak a few weeks ago of Justice Alito's primary decision written. And though I have to say it was an incredible shock to the gut as to what his legal thinking or misguided thinking was written in that draft proposal. But in a way, it was a wake-up call for all of us to realize that this was very real. Because I think a lot of people thought that as for the past 50 years, whenever those opposed to reproductive freedom proposed something, those of us like Planned Parenthood or NARAL or NOW or the ACLU would fix it. We would figure out a way to work around whatever was being proposed and mitigate the impact on the pregnant people and their families. And this time, we can't fix it. If the Supreme Court rules anything close to what Alito was talking about, we're no place but up shit creek. I'm sorry. Just plain flat, we're out of luck. And, you know, I have to say, I don't like taking my politics from Saturday Night Live, but when they did their opening skit in talking about how when the Constitution was first written, women didn't have the right to vote. Women didn't have a right to anything then. And they were going to base their rulings on what was real then. It was like, wow, we are really out of touch with what the world has come to. And so I'm, in some ways, I have to say perversely, kind of interested in what the Supreme Court is actually going to say, what rationale they're going to come up with, and expect us to believe that they are learned, more learned on the law than we are in their interpretation of the law. And yes.
Karrie, can I interrupt just a second?
Sure.
Catherine Weller is on. I think this is a good place for her to tell us if
Okay.
that's what they're going to do and what it's going to mean for the Utah ban.
Wonderful.
Okay, go ahead, Catherine.
Hi, everybody. I apologize. I warned Jill I had a meeting right before this and would be a few minutes late. So I'm glad you've had such an interesting start to this unfortunate Zoom while I was finishing up. And it's unfortunate because it's regrettable that we're gathering to talk about the very real potential for forced birth to be the law in Utah. That is exactly what we're talking about here when we are talking about Utah's trigger law. To start with, I will have to say, or I will mention that I would be remiss if I didn't discuss a bit about league positions and the league at this league event. So just a sentence from the joint statement issued by Virginia Case, who is the CEO of the League of Women Voters, and Dr. Deborah Turner, president of the League of Women Voters. So they're on the national level. Their joint statement said, reproductive care is essential health care and a fundamental right that the Supreme Court is preparing to undermine. If this draft opinion holds and overturns Roe v. Wade and Planned Parenthood v. Casey, it not only strips women and pregnant people of their personal autonomy, but opens the door to erode more fundamental rights. As an organization that believes in the power of women to create a more perfect democracy, we will fight to preserve the individual rights of women to make their own reproductive choices. They conclude with all people deserve access to quality health care, including abortion, and the privacy to make reproductive choices. Today, Roe v. Wade and Planned Parenthood v. Casey are still the law, and we stand with our allies to protect women's access to health care. It is critical that we show up in solidarity and make our voices heard for reproductive choice. Our democracy depends upon it. In this case, as with other significant cases within the states and on the federal level for a number of years, the League of Women Voters has either filed or joined filing amicus briefs. And we did that in Dobbs v. Jackson's Women Health. We were also co-sponsors of Bans Off Our Bodies, and leagues around the nation participated, including here in Utah. We are continuing to support the action of our allies in the reproductive rights sphere. We recognize, the League recognizes that people like Karrie and Planned Parenthood, organizations like Planned Parenthood, are the ones with the expertise and the organizational background in this fight, but we also recognize that they can't do this alone and we all need to pitch in. So at this point, League leadership is currently strategizing and preparing for action to support our sister organizations when the SCOTUS decision is announced. I have a sneaky feeling that this announcement will probably be during convention, when we are all meeting in Colorado to talk about our national policies for the upcoming years. If that is the case, I know you can look forward to some further emergency resolutions. On to Utah's trigger law. First, if you haven't read it, the State League completed an educational study in 2020 called Utah's Abortion Laws. It's well worth reading. If you haven't read it yet, I highly suggest you check it out. It can be found on the League's website, and I am dropping a link to that study in the chat box right now. That study was approved by the membership in 2019 in anticipation of legislation in the 2020 session. That session, the legislature passed 7, count them, 7 abortion-related bills, including SB 174, which we now know simply as the trigger law. That study prohibits, that law prohibits a woman from receiving an abortion in Utah in the state of with limited exceptions. I'm going to read the language of the law's definition of abortion, the actual language that was in this bill, because it is telling. It defines abortion as the intentional termination or attempted termination of human pregnancy after implantation of a fertilized ovum through a medical procedure carried out by a physician or through a substance used under the direction of a physician. 2, the intentional killing or attempted killing of a live unborn child through a medical procedure carried out by a physician or through a substance used under the direction of a physician. 3, the intentional causing or attempted causing of the miscarriage through medical procedure carried out by a physician or through a substance used under the direction of a physician. This definition applies, this law applies at any stage of pregnancy from day one. And you can tell by the way I emphasize the word killing and unborn person, where the philosophical foundations for this law that will most likely evolve into proposed legislation coming up to prohibit the importation of medical abortion or pharmaceutical abortion supplies into Utah. I think we can look forward to that in the next session. The allowed exceptions are the risk that the woman will die or suffer substantial and irreversible impairment of a major bodily function, that's a quote, certain lethal defects, just certain defects, rape or rape of a child or incest. The bill takes effect when the Legislative General Council certifies to the Legislative Management Committee that a court of sufficient authority, and for purposes of our discussion here today, that's SCOTUS, has held states may prohibit abortion at any time during pregnancy. At this moment, it is important to remember that has not happened yet. We are still in a state where, in a state of being where abortion is legal in the state with certain exceptions. If SCOTUS goes the way we anticipate it will, that goes into effect. If by some grace of God, they pull that back and go a different way, the language in this trigger bill prevents it from coming into effect because of that language specifically about any time in pregnancy. So if they if SCOTUS does say something like 15 weeks again, there are other abortion laws that will go into effect that will ban abortion in the state. Some of those bills, those other 7 bills from the session. And you can bet they'll be acting to modify that further. We have no reason to believe at this point that SCOTUS will not, but I guess we can remain hopeful. What I am not clear on, because I'm not an attorney and I didn't delve deeply enough into the statute itself, is the causes of action that could be taken to, not the causes of action, who can file complaints and where. Now, complaints can also be filed against physicians for performing abortions, either surgical or medical, and against the facilities who enable these procedures. So things like the very operations of Planned Parenthood that I know Karrie can talk about further are endangered by this law. So I think that this is where I should turn the time back over to Karrie. And Karrie, maybe you have a sense of who it is that can file complaints and when, because I didn't get to that in the law.
Thank you, Catherine. Karrie, it's your turn.
That was a really wonderful layout of what we're facing here, Catherine. As we wait for SCOTUS to rule on the Mississippi case. And the options that SCOTUS has. At one point, I was sort of hoping that our best case scenario would be that they would say 15 weeks. You may remember that a few years ago, we also passed a law in Utah eliminating abortion at 18 weeks. And that case is in the courts. It actually has been stayed twice, waiting on Supreme Court rulings. The first time we won in the Supreme Court, and so the case started up again. The second time, we'll see how SCOTUS rules, at which point my guess is if they rule at 15 weeks, the legislature would call themselves back into session and go for 15 weeks. For those of you who have been keeping track, the majority of abortions in Utah, in fact, the majority of abortions across the country, happen before 15 weeks. And so in Utah, we would still be working to meet the needs of pregnant people and families beyond 15 weeks. And those are such difficult cases because it is usually a wanted and hard-won pregnancy that has gone awry. And the best choice or a choice for the family is to terminate a pregnancy to preserve the life and health of the woman for possible future pregnancies. So right now, Planned Parenthood nationally has been working for a number of years, looking at the possibilities of a SCOTUS decision that would narrow women and families' abilities to control their own fertility. The first state to take action, as you're talking about, Catherine, is Texas. And that law has been in effect since last September. And the Supreme Court has turned the other cheek, as they say, in ruling on it, because they knew that they were going to rule on the Mississippi case. And so basically, abortion has been outlawed in Texas after 6 weeks, when there is some activity that some people call heart activity. Your physicians would not say that it's a beating heart. They would just say it's activity. But unfortunately, for most pregnant people and families, you don't even recognize the pregnancy till after 6 weeks. And so the option of abortion is basically outlawed in Texas. That law has action. And they created that law specifically to not make anybody accountable that is in the usual way, meaning the state, the health department, the licensing people. The action that Catherine is talking about is for anyone to choose to file a lawsuit against an abortion provider, and they are guaranteed $10,000 should they find that an abortion had happened outside of this new law. Our law in Utah does not have that cause of action. A number of states that have rushed to change their law during the 2020 year lawmaking sessions around the country have. One of our closest neighbors in Idaho has a similar law that was passed. It is now enjoined in the courts. It could become unjoined at any time. We at Planned Parenthood of Utah serve many women for pregnancy termination in the lower or the most southern part of Idaho in our Logan Clinic, where we provide medical abortion. And we are working with the Planned Parenthood in Idaho to make sure that we can serve women who are confused about the law being enjoined in Idaho right now. But Utah laws do not have the cause of action that allow anyone that chooses to file suit against the abortion provider. Though, as Catherine stated, we don't know what will happen in our next legislative session. We in Utah are not new to lawsuits in protecting pregnant people, women, and families for reproductive rights. We have often joined with our national organization, the Center for Reproductive Freedom, the ACLU, in keeping laws that are detrimental to pregnant people and families here in Utah out of enforcement, as we are now in the 18-week case. I have to say, one of the things that we have done over the past few months is, as they say, get our ducks in line for the new SCOTUS ruling. We have engaged new lawyers who are skilled in court action in state law. Most of the time, when we are fighting these laws in past battles, we are fighting in the federal courts. We have now engaged lawyers who will work for us, who fight in the state. And unfortunately, a few weeks ago, we needed to engage with criminal lawyers because we are concerned that depending how SCOTUS rules, there will be a new way of looking at women's reproductive health care and rights, and that doctors, without intention, could run afoul of the law in providing advice and help to women and families in dealing with problem pregnancy. And because we take seriously our obligation to people who work for us, we have engaged with criminal lawyers also to make sure that we can defend them. We are looking at also neighboring states that are not like Idaho, but that might be more thoughtful about how they approach reproductive rights. And we happen to have some good neighbors. Colorado has worked diligently for years to enshrine in their laws the right for women and families to make their own reproductive decisions. Though to get to Colorado and safe and legal abortion is at least 6 or 7 hours. And so that's certainly a trial for many people because you would have to find childcare. You would have to be able to leave your schooling or your job to make those sorts of trips. And it's not how we want people to have to get their health care. The majority of pregnancy terminations in Utah happen in Salt Lake City because of our regional health care provisions. There are 2 abortion providers in Salt Lake. A small Wasatch Women's Center, and Planned Parenthood. Excuse me, in 2021, Planned Parenthood provided just over 2,500 abortions. Utah has one of the lowest rates for abortion in the country. People in Utah, I have always felt, live their values. Over 50% of them are medical abortions done with pharmaceuticals, where a woman still needs to follow all the rules of the state, meaning 72 hours, state mandated information before she makes an appointment for a termination, as well as watching the state mandated video and discussion. Planned Parenthood has always worked to mitigate whatever rules and regulations of the state. One thing that we have done for years is to make sure that we have technology that allows women to get her state mandated information without having to physically come to a Planned Parenthood healthcare center and make those 2 trips. What we are looking at, as well as making friends with healthcare providers in Colorado, Nevada has better laws than Utah. And we all know that it's only 2 hours to Wendover. Unfortunately, West Wendover is not a regional healthcare mecca of the world. And we would have to create healthcare for people in West Wendover. There is healthcare available for women in Reno, but that's about 10 hours, or from Salt Lake, we were talking at least 6 hours to Vegas. So we may have to get very creative in making sure that we can provide quality, comprehensive healthcare for people who have the ability to travel. One thing Planned Parenthood has also done is tried to work with the lawmakers in Utah. In 2020, when the trigger law was passed, we had anticipated a rough legislative session for reproductive rights and had gathered with many of our partners in reproductive freedom, the ACLU, A Better Utah, the University of Utah, and commissioned a poll with Dan Jones and Cicero, and looked at public feelings about abortion. And we found, excuse me, that a majority of people in Utah did not want more abortion laws in Utah. We felt there was enough. We did not feel that politicians should be one making these laws. We also felt sex education should be more readily available for families and young people. And we looked at the exceptions that most people felt when we're talking about allowing people to have an abortion after the state has rights in the 3rd trimester. When it was 2022, we were a little concerned. Polling is very expensive. And we knew that a lot of discussion had gone on about reproductive freedom during the past 2 years. But Planned Parenthood decided we just had to rerun that poll again. And so in January of 2022, we went back to Jan Jones and Cicero and reran the poll. And it turns out that the legislature was not choosing to further restrict reproductive rights during the 2022 session. They were counting on SCOTUS. So we did not release the poll results at that time. But when Alito's draft decision was released, we decided it was time to let the people of Utah and our lawmakers know what the people have felt. And what we learned in 2022 is 86% of the people of Utah believe that the pregnant person, not a politician, should be making the laws, should be making reproductive decisions. We also learned that 76% of the people felt there was no need for further abortion laws. And 55%, which in my book is still a majority, felt that abortion should be legal in all or most cases. This is what the people of Utah believe. Unfortunately, our lawmakers, in their views, feel differently. They are willing to take their own personal morality and inflict it on all. And this is why we need groups like the League of Women Voters speaking up and not only talking to their own family and friends and lawmakers, but their neighbors, everyone they come into contact with, to remind them that we make the decisions about our families. We make the decisions about our bodies, and that the lawmakers should not be involved. We have found through all the activity that has come since the leak in public gatherings that the people echo these feelings. And so as we prepare for what we call Decision Day, we are so thankful to have groups like the League of Women Voters willing to talk about this, willing to agitate, do what you all do best, and remind everyone what civil engagement is all about. It's the people speaking for the people. And so I'm just so happy that you were willing to spend some time today in considering what the Supreme Court seems to be willing to do, and if they should do it, what our own legislature may be willing to do. And without us speaking up and getting everyone else to speak up, they will make the rules. They will decide how to form our families. And what I find so distressing as we go through each legislative session is that for a number of years, we've had legislatures like Derek Kitchen put forth an expansion of family planning in the Medicaid program so that more women can control their fertility and not find themselves in a decision-making mode when it comes to a problem pregnancy. And each of the 3 years that it's been proposed, it's never made it to the floor for a vote.
Yeah.
They are willing to push their own morality on everyone else, but unwilling to provide the means for families to control their own fertility. And we look at how we spend our money for public service for the families in need. We are not expanding maternity care as Rosemary Lesser has suggested in the legislature this past year. They were unwilling to consider it. They may force you to carry a pregnancy to term, but not help you carry a healthy pregnancy.
Right, Karrie, we're getting
Yes.
a lot of questions into the chat.
Okay,
And so we have about 10 minutes. I'd love to get some answers, but they're going to need to be short.
okay.
Let's see here. What's the percentage of women who have had more than one abortion in the US? Do you have any idea?
I actually don't. I can find that out for you. The majority of women who have terminated a pregnancy have been mothers themselves. So they know the reasons why they are terminating a pregnancy. And it's the same case in Utah.
Okay, thanks. How many of these restrictive laws in Utah have been prompted by religious groups?
I can't tell you specifically other than the rhetoric people use as they promote it. It's a personal moral. It's coming from their own personal moral feelings.
Okay. Martha Olson asked this one. It's kind of long, but interesting. I would like to hear any perspective on Mexico's model of abortion rights. This was highlighted in a New York Times daily podcast on May 17th. Because Mexico didn't have a Roe versus Wade, they have over the years set up a network to help women self-administer abortion medication with the support of the network, but they aren't physicians. Do you know about that?
Yes, it's interesting, as the United States has restricted abortion rights for the people in our country, women throughout the world have been working to expand abortion rights. And the story of on the ground women taking matters into their own hands, especially using medication abortion, has become much more used in many countries around the world. It doesn't need a physician.
Okay. Okay, that's all I see in the chat. So let's open it up. Just raise your hand. I'll try to see you. And where shall we go? Chris Cherniak. Chris, unmute.
Thanks for this really interesting presentation. A couple questions or clarifications, so much information. One was with respect to, Catherine, you talking about the law, SB 174, and some of the limitations associated with complying with the law. One of them was with respect to rape. Correct? That's so first, okay. But that requires proof of rape, right? And so can you just spend a minute, I know you can spend much more, talking about whose proof what proof is required, and that can take months and months and months if it's proof via a court system. Can you talk about that?
It actually doesn't have to be proven through the court system. The woman has to have reported the rape to a law enforcement. But we all know the statistics that women don't report rape.
Right.
Yeah, thank you, Karrie. I was flipping back to the law really quickly there to find out what the reporting requirement was exactly, but it is simply requiring reporting, nothing past that. And as Karrie pointed out, that's really insignificant in terms of what happens, as we know, with rape, and I'll just include incest in that why incest is not also rape, but there we go. I did, in researching for this, come across recent comments from one of the bill sponsors who stated outright, very happily, that SB 174, when it takes effect, will prohibit all but approximately 2% of abortions in the state of Utah.
Up to 2%. Okay. One other follow-up question. Talk about the penalties. What are under this law, if somebody breaks the law, quote unquote, what are the potential penalties and consequences?
At this moment, the woman is not penalized by this law. It is the providers and the clinics. And the penalties are part of the statute that I didn't get into. Do you know those off the top of your head, Karrie?
It is a financial penalty, and because then there would be a conviction, it would be a loss of medical license, possibly.
Okay, thank you.
Okay, more questions? I've got one, Karrie. Under what circumstance would you think that Planned Parenthood clinics in Utah would actually have to close?
There would be no reason that Planned Parenthood clinics would have to close. And I have to say, without a doubt, we won't close. Abortion, even though it seems to be the topic of conversation, is only about 3% of the work that Planned Parenthood does. In fact, Planned Parenthood of Utah has only been doing abortion for 11 or 12 years. Our initial business is family planning. Not only the medical provision of family planning, the education, the outreach, but also making sure the family planning stays legal. For those who are history buffs, remember that it was only in the 60s that married couples were allowed to practice contraception. And, if they're going to take away abortion, they can also take away the laws that let people plan their pregnancies. It's a little crazy making, but we will always be there to make sure that reproductive health care is available to people. You may be surprised to know that we also help people get pregnant who are having trouble getting pregnant with infertility treatments. We cover the whole gamut. So there's no reason for Planned Parenthood to shut down services.
Thank goodness. Okay, we have a question for a minute, 1 minute for another question or comment.
I encourage all of you to go to our website and sign up for Bands Off Our Beehive, so that you can be involved, so you can know the latest and greatest of what we're doing to resist those lawmakers. And, we even have swag. You can get a t-shirt, Bands Off Our Beehive, if you should choose to wear it on your chest, to let people know your feelings.
Karrie, are you
Almost as
saying
good as I read a banned book library card.
Karrie, are you saying go to the Planned Parenthood of Utah
Yes,
website or Facebook page or both?
yes. And we will also put it in the chat. Someone's
Okay.
going to help me put it in the chat for you
Okay.
all.
Sounds good.
Jill, I have just re-put into the chat the League History of Abortion Law in Utah. It's more than 2020. It's a pretty good and deep study. So please do access that. It gives you a nice little history lesson there. The last thing I'd like to share, so you do know how deeply that the League has our back.
Oops.
Kerner, the president of the National League, is one of those strange birds. It's a JD MD. She got her MD first, and when she was in medical school in 1973, one of her first patients was a woman who had suffered from the effects of an illegal abortion. She went on to specialize in healthcare for women, and after getting, or I guess while getting her JD, since 2016, she has been Associate Medical Director of Planned Parenthood of North Central States. So for her, this is a big deal on a lot of levels, and we can look forward, because we have been engaged and committed to this in a while, we can look forward to further engagement on this.
Oh, that's very cool. Okay, Catherine and Karrie, thank you so much. We've just had the last 5 minutes here, and I want to turn it over to Chris Cherniak. He is president of the Summit County Board of Health. Give us a 5-minute update on anything healthy we should know.
Well, this is these two topics are minor in comparison to the topic we just covered. But yes, as chair of the Summit County Board of Health for the last 2 years, we've been tracking the virus, and I'll just give you a quick update there. I'm sure most of you know, again, no surprise. The most recent Omicron variant is still around, and we had a little uptick in the number of cases here in Summit and Wasatch counties over the past month, but that's kind of leveled off in the last week or so. We still have one of the, relatively speaking, we still have one of the higher rates of cases here in the state, but nowadays getting those numbers are obscured and kind of squishy because fewer people are getting tested. So it's not a very equal playing field where to compare county to county. But in any case, the virus is still around. Boosters are still available. I'm going to get my second booster today at the department through the Summit County Department of Health. Call them, stop in, sign up. And it's quick and easy. So cases are still around. We still take precautionary measures. I still see lots of people wearing masks, etc., which is good behavior. So that's the latest on COVID. And with Jill mentioned monkeypox. I'll spend like 45 seconds on that. Not a big deal. It's here, it's around. There are people that have contracted 2 cases in Salt Lake County, all of Utah so far. This is a disease, a virus where, and then this is chatting with the head of Department of Health, Phil Bondron. You really have to be in close physical contact with a person who is carrying this virus in order for you to potentially catch this virus. By close, I mean really, really close contact. This is not necessarily an airborne based virus like COVID. So it's around, it'll still be in the news, but so there is some evidence that even having a smallpox vaccine has provided some protection against this vaccine or this virus. But that's the jury is quite out on that. Anyway, that's your updates on those 2 items. If you had any questions or comments, 2 more minutes. Thank you.
So Chris, you're saying that my 50-year-old smallpox vaccination, that's still a little scar on my arm, might protect me from monkeypox. Is that it?
Yes. Let's say it's not a bad thing to have that vaccine. Yet another good reason why you should be vaccinated for a number of these different viruses. Some beneficial, additional benefits associated with that smallpox vaccine. So yes.
Chris, back to the COVID vaccine. Do you happen to know if the content of the booster is the same as it was the end of last year, or has it changed with the new variants?
Yeah, honestly, Amy, that's a good question, and I can't give you a clear answer on that one. Other than I haven't read that it's any different or has changed dramatically, but that's just based on my limited readings, of papers, et cetera. So no, I'm not the best source to answer that question.
Amy
Okay.
and Chris, when I got my second booster a couple weeks ago at the University of Utah Healthcare, I asked if this is the same thing as the first. Are they, every time you get a shot, are they all the same? And she said, except that you're getting one Moderna and one Pfizer, it doesn't matter. They are the same.
Okay, thank you.
Thank you.
Okay, you all, it is 12 o'clock. Thank you for a fabulous discussion. Thank you again, Karrie and Catherine, and thank you all for being here. See you later.
Thank you.